Pompeii and Bastille. It's the Dari Mitch and Ted Show. Dari's off today. Ted and I are here, and welcome to the show our friend and cosmetic surgeon, Dr. James Chan.
Hi.
Hello, sir.
Hello.
Dr. Chan's a double board-certified physician. You're an ear, nose, and throat specialist, as well as being a cosmetic surgeon, and an all-around great guy.
Well, thank you.
Now, Ted mentioned, and I was actually, before you got here, I was looking out, feeling the heat coming from the window. It feels like this summer's never going to end, which is a great thing. But eventually, the clouds will come, the rain will come, and the sun will seem to go away. But we don't need to let our guard down, shouldn't let our guard down when it comes to skin cancer, should we?
Right. No. Skin cancer is very, very common here in Oregon, despite the fact that we get very little sun.
You wouldn't think that, would you?
You wouldn't. But I think, the majority of the population is pretty fair-skinned here. So, the little bit of sunlight that we do get. And then people, they tend to, it's almost like binge drinking.
Well, you're so excited to see the sun when it shows up.
Exactly. So you go out there and you get as much of it as you can, and you tend to forget the sunscreen. But, yes.
Or you go to get the sunscreen, it's all dry. There's nothing in there. It's just dust that comes out.
I'm guilty. I never wear sunscreen in the wintertime, and I suppose I should. I'm not outside much in the wintertime, but, I mean, does that matter? If you're just going from your house to your car and your car into your office, do you still need to put on sunscreen?
And you really should. A lot of people don't. But even that little bit of sunlight or UV ray is enough to cause skin cancer.
And we know in your practice you do work on patients that have had skin cancer, and they've had, both my mom, my dad, my brother, I also have had things removed from their face, and my mom had a pretty good chunk of meat taken off her nose years ago, and they didn't do a great job patching it up.
Some nose meat?
Some nose meat. And everybody's fine, thank God, but you can see where she had it removed. What are our patients' options when it comes to something like that? You've had something removed due to a melanoma. What's the next step?
Yeah, so we actually get a lot of patients who've had things taken off their face and sent over for us for repair. Also, we get a lot of patients who get sent in from their primary physicians wanting, to have us take things off to check for cancer. But it's very common, especially around the nose area, to lose a lot of tissue. I mean, cancer doesn't have to go very deep to lose some cartilage and some other important structures that can affect your breathing, the function of your nose. So it's really important the way that we repair it. We not only make it look good, but we make it work well so that you can continue to breathe.
Right. It has a function. It needs to continue to do that function.
Exactly. And is that something you're especially good at because you're also an ear, nose, and throat physician?
Exactly. So I'm very mindful of the airway. I mean, that's a very important part of what I do, is making sure people can still breathe well despite, whatever it is that they're having removed. A lot of times we have to do very complex repairs that require borrowing ear cartilage and sometimes rotating forehead flaps down to cover up, big defects. But
because there's not much extra skin on the nose. I mean, once that skin is gone, so you would retake skin off the forehead and kind of, you're saying, fold it down?
Correct.
And then cover, wow.
Yeah, so you flip it over and you cover the nose, and then 3 weeks later, you actually go back and you divide that. It's called a pedicle. So it's getting blood supply from the forehead. You go back 3 weeks later and you cut it after it's grown into the nose. And
then how does the forehead skin grow back? It just naturally grows back?
Usually you're able to close it so you can
spackle.
Okay, because there's more skin up there.
Exactly.
Okay. Or spackle.
You can free up the skin up there and close that up. But it can require a lot of complex repair, and like I said, sometimes you just look terrible for a while, but then once we get everything put back together and put back in place, you can look amazing and almost like nothing happened.
If you have something on your face that has to be removed, you have a skin cancer on your face, is it better to go to a cosmetic surgeon to have that removed rather than a dermatologist? I would think a cosmetic surgeon is going to know how to remove something and have it to leave as little effect as possible, little result as possible.
I think either one is fine. The main thing is to get it checked out, get it biopsied, meaning have it removed and sent to a pathologist so they can look at it. A lot of times I work with dermatologists. When it comes to big holes like in the middle of the face involving the nose or lips or eyelids, a lot of times they don't want to repair that, or they're not comfortable repairing it. So they'll remove the cancer, they'll send it to me to repair.
Interesting.
Wow, that's crazy.
Now, I know in addition to surgical procedures at your practice. You also do non-surgical treatments, a lot of skin treatments. And I mentioned before we went on the air, I had some questions about acne scars.
Yes.
And you said you would love to hear my questions about acne scars. So here they come. The reason I bring this up, I was watching Saturday Night Live over the weekend, and Adam Levine, Maroon 5, they're performing. And they had some camera angles and some lights, and I was able to see some acne scarring on Adam Levine I'd never noticed. I know he talks a lot about his problems with acne in the past. He does commercials for Proactive. What can be done about acne scars? First of all, what causes them? Does it mean somebody was popping their pimples when they were young? Is that the cause?
The main reason is because you get these large cystic acne, at some point in your youth, and what that leads to is big scars, big craters.
Even if you don't touch it, even if you're not.
A lot of times, even if you don't touch them,
Okay.
So the problem with acne scars is they're very hard to treat because they're basically throughout the thickness of the skin. So there's no good way to really,
It's not just the surface.
Exactly. It's not just the surface. It goes deeper than that. So depending on the type of scar, we do have some options for making them look better. Sometimes you can laser them. Sometimes you can add fillers to kind of, lift up the crater. Sometimes you can do a combination of those things. There are various ways that you can try to make them look better. But
it's all about improvement. You're not going to remove them.
Exactly.
Basically.
Improvement. and generally, I tell patients, expect anywhere from 50 to 80% improvement. You're never going to get 100%. Sometimes with the real bad acne scars, we'll actually cut them out. So you individually remove some of the
and then
scars.
Stretch the skin that's left.
Right, and then close them. And then, you trade a big crater for maybe just a small little line. And sometimes that's the best you can do.
Yeah, that was my question. Somebody like Adam Levine has all the money that he could possibly need. He could get the best treatment available. I was surprised to see that he still has the scars.
Well, somebody like Ray Liotta has famously, when he was young, had pretty severe acne scarring. And, they do what they can in the movies for makeup and stuff. But in recent years, that scarring seems to be gone.
Yeah, he looks a whole lot better.
Yeah. Generally, lasers are our best treatment option. I mean, if you're going to do anything, I think for acne scars, that would be the way to go.
And what age would be appropriate? When would you start? Would someone in their late teens, if they have the scars already, or do you want them to be a little bit older?
Yeah, a little bit older. You want the acne to be pretty much under control. So sometimes people come to me with active acne, and I'll tell them, go to your dermatologist, get that treated. Once that's stable, then we can talk about treating the scars.
All right. Dr. James Chan is our guest. If you have questions about cosmetic surgery, it's a very comprehensive website. It's drjameschan.com. Before and after pictures. He has testimonials, info about financing, all the different treatments they offer in his practice. And it's always a pleasure to talk to you.
Thank you very much.
We'll see you in a couple weeks.